Good morning, everyone. My name is Ufoma More. Welcome to my journey with Parkinson's. Like I said before, I was diagnosed with Parkinson's 9 years ago, and I've been living. Now, today we want to talk about caregivers, people that your partner, your wife, your nurse, people that take care of you in this your journey. Okay?
Why is it important to talk about caregivers?
Because most people are diagnosed when they get diagnosed, the symptoms have already come out. Most people get late diagnosis. They know when they can't move, when they can't, when the disease has progressed. So most times you need people to help you do certain things that you can't do. And I mean, if you detect it anyway, you can stay on your own. But most people in Nigeria get their diagnosis after the disease has progressed.
Why is that so?
Because no, but there's positive. This is not very prevalent, like I said before. It's or recorded cases. Let me just clear that. Recorded cases are not many. And initially, when I started having my symptoms, this is that started earlier on. But when I had mild symptoms, I was always I was very slow. Like I said, I was slow, and maybe because I had a HM, I was working, so I could easily go to any doctor I want to. So when I mean, I had access to medical doctor free also. So they suspected Parkinson. Initially, like I said, they didn't think it was Parkinson because of my age. Because of my age. Then when it became obvious it was Parkinson, I started thinking, then I went to the hospital. I wasn't having tremors. I was just slow, which is one of the symptoms of Parkinson's. So when um, when you now if you start taking your medication on time, if you start taking your medication on time, you might not need a caregiver for a long time, but like I said, not in Nigeria, and Parkinson's is usually common amongst older population. So all the people that I see, they normally have nurses, they normally have people that take care of them. Then with Parkinson's. So, but and why I want to caregivers, why I'm talking about caregivers, is also important with your journey with Parkinson's.
Hmm. Well, how important is it?
Okay.
What's the role of the caregiver? You say you can still do things on your own.
Well, for now, I can do like I can't. I don't want to wash my. There's certain things I don't do anymore. I don't drive. I drive. I can drive, but I don't drive a long distance. So my wife has taken up that journey. When we're going, when you go out with your spouse, usually the man that drives. But my wife drives many long distance. If I'm going to go down the road, I would drive by myself. But if I'm going far and we're going as a family, my wife drives, so she's a caregiver. And certain times I might be tired, I might be weak. Sometimes there are some days that are really bad, really really bad. Your medications are not working. You can't move, even when you're doing what you should do, taking your medicine and exercise. Some days it just doesn't work. That's so those days I can't walk or I can't do anything. You need someone to help you to do something. Or if you don't have, you do have a caregiver. Anything can happen at any time.
So when you say caregiver, who falls into a caregiver? Who would you describe as a caregiver?
Your wife, someone that lives with you. Maybe your wife, your child, your brother, your sister, or you have a nanny, or you have a some like some people that my should I say my fellow warriors. Quite their conditions are quite debilitated already. So they need people to hold them. They need walking stick.
I noticed that you didn't say husband. Don't husbands give care?
Oh yeah, there's one wonderful man in my group. He stays with his wife every step of the way. And I told him, this man, you try, right? I say, if a woman, if na, most men will just, most women that come, they don't come with their husband, but most men come with their wives. I don't know why. Maybe we live in a misogynistic society, so it depends on
Or maybe
anyway.
the men are busy trying to make money for the
Yeah.
house.
Yes, that too. That too. So
You guys need to know.
you have to be patient. There's a saying: if you've seen one Parkinson patient, you've only seen one. Meaning, like I said, the disease presents itself in different forms. Some people can't sit down like they'll be having tremors. Tremors, they are shaking. But some people have rigidity. I don't know which one is better. Some people they are slow, rigid, and and tremor. Tremor is the most noticeable ones, and unfortunately, or should I say, unfortunately, it's the hardest one to control because, like I said, cinnamon. Like I said, the greatest drug for it that I discovered, like the wonder drug, cinnamon. It helps for stiffness and rigidity, but not so much helpful for tremors. It helps tremors, but not as much. If you started treatment on time, probably it will help. There's something I always say about caregiver. Tell my caregiver, if you know at what stage your Parkinson's is, you can actually help better. What do I mean? If you know your husband has tremor, sorry, your husband or your wife has tremor, there's a way you know when he wants to eat, you have to be time when his symptoms are reduced so that he can eat, so that he handles she can eat. So you have to observe. You have to help them when they want to, and sometimes we can be if they need help, and sometimes they should be patient with them. Sometimes they want to urge you to do something, but you can't do it.
Why do you keep saying patient, patient? You said that like 4 times. What's the importance of patience in caregiving?
Because it's frustrating now. Because you are going somewhere and the person is slowing you down, person needs help, person is calling you, I can't stand up from bed, I can't stand up from chair, I want water, I want this. Some even follow people to the bathroom to take number two because they can't get up from the toilet seat. So if you are doing that as a wife, no matter how much you love the person, it's tiring. And it's not good I mean, I'm being realistic. It's too much, sometimes too much for some people.
Is there a way of training caregivers so that they can manage better?
Honestly, that's the problem we have in Nigeria. We have, like I said, even in the normal neurologists that you go to, they can't help so much. But you need to they know how to diagnose, they know how to, well, the neurological, but you need someone that is special, that is a specialist, a movement disorder specialist. Those ones, they help you design, they know everything about Parkinson's, they know what you can do. They design exercises too. And they have Parkinson's nurses too that are trained so that they give you exercises, not just any exercise. You need to there's some exercises that you need to do. They know the symptoms. Maybe like if you want to, let me say, people that have tremors, you have to squeeze your hand, open it, squeeze your hand, open it, squeeze your hand, open it. Sometimes sit to stand. They tell you what to do, what part of your body to use. So they design so many things. So that's why it's good to that's answers why you need the caregiver.